I'm Don Gray. Enid is going to be sitting in on another session to support some of the people that she's brought along to that session. So she asked me to facilitate this session. As I say, I'm Don Gray. I'm a member of the Secretariat. It's my privilege to welcome you to this session this afternoon where Dr. David Bratt and Dr. Kevin Morris are going to address the question, is being on benefit bad for your health? I wondered whether being on the Secretariat was bad for your health, but we'll leave that one to another session. So David Bratt is a Principal Health Advisor to the Ministry of Social Development. He started as an Otago Medical School graduate, and it says here that he always had a health focus rather than a focus on disease. He moved into general practice in the early days when general practice heavily involved in obstetrics. Apologies for my mispronunciations. During that time, he was involved in training GP registrars and also teaching at the medical school here in Wellington Clinical School. He has provided 30 years of wonderful service in Newtown and Wellington. He moved on to a new challenge at that stage, working with secondary and tertiary services, developing the role of GP liaison and primary care advisor with Capital and Coast Health. He's moved on to the challenges within the Ministry of Social Development to work on the wider determinants of health in the newly established position of Health Advisor in our ministry, and we're very pleased to have him. I should say that I'm from the Ministry of Social Development, and he's a member of a working group working on a health benefits paper, which he'll talk about. So David is going to talk to us, and then we're going to hear from Dr. Kevin Morris, who is Clinical Director at ACC. So Dr. Morris has worked with ACC since 1992, rising to Director of Clinical Services in 2006, following appointment as Corporate Medical Advisor in 1998. He's had extensive experience in compensation medicine and is recognised in New Zealand as New Zealand's foremost authority on impairment evaluation. He has a background in general practice and obstetrics, occupational medicine, computer science and medical administration, and a particular interest in the relationship between health, employment status and compensation systems. Before joining ACC, Dr. Morris was principal in a group general practice, the principal doctor of one of New Zealand's first after-hours medical clinics, and a consultant with technology company developing software for medical practice. Most recently, he's completed a Masters in Public Policy at the School of Government here at Victoria University. His research paper looked into the impact of lump sum compensation for non-economic loss on rehabilitation outcomes. I hope I got that right. Health purchasing is a specific area of interest with practical application of the evidence that establishes employment status as a major determinant of health. So between David and Kevin, they're going to help us look at that question of being on benefit. Is it bad for your health? So they're going to give a presentation each. If there's any points of clarification during, they'll clarify that. But once they've done their presentations, first David and then Kevin, then there'll be some time for some interaction, some questions and so on. So without any further ado, I'm going to hand over to David, and hopefully we have a good interactive session. Thank you.
Thank you, Don. Right, well, good afternoon, everyone, and I must admit it always seems difficult to follow after that extraordinarily inspiring speech we had from Dame Eritana. I felt really there was nothing else to say, in fact, to really talking about how we empower people. Nonetheless, we were challenged with, could we offer some evidence that a benefit, and in this case I'd hasten to add benefit is really a surrogate marker for worklessness, or what I noticed was called joblessness in the presentations by our Australian visitors earlier. You may wonder where the title comes from, and I hope that will become more obvious as I go along. At this point, technology may defeat me because I'll either go forward or backwards. Oh, we went forward. So today, what I wanted to briefly cover was the adverse effects of worklessness. I wanted to give a context of that, And then really, I've called it a response, but to some extent it's how do we create an environment of optimism. I'm essentially giving the context, and then the real evidence will actually come from Kevin, because I really feel a bit like the sandwich, a great presentation before, I'm the kind of opening act, and then the real act will come along afterwards. I was going to say, ladies and gentlemen and distinguished guests, somebody, when I first started doing some speaking, pointed out to me that the way you knew there were distinguished guests was there was usually signs at the front that said reserved, but I couldn't see any today. So, but there were some in the other one, so I guess it is relevant. So what is benefit sunshine, or what do I mean? Where did the title come from? Well, it really came from the fact that, you know, there's no question that there is a need for any caring society to provide a safety net for the vulnerable citizens. And really there are times that benefit really is important. And I've called it a ray of sunshine, but I need to remind most people, perhaps not everybody, that it is rather a small ray of sunshine in a way. For those of us who live in Wellington, we probably spend more on coffee and parking than most people have to live on if they're on a benefit. It is not a life of luxury. Nonetheless, a benefit, but like the sun, if you're exposed to it for too long, can cause significant harm. And there's very good evidence of that, and that's really what we wish to cover today in a sort of small segment of what is obviously a much wider debate. So what are those not so positive impacts? I don't know why quite I used a negative there. I should have just said the negative impacts, I guess. Now, the first thing to point out, of course, is these are mostly time-related impacts. Again, my analogy of using the sun, a little bit probably doesn't cause any problems at all. But the first one is obviously worklessness or work disability, an impact on your capacity to do the job. I'm actually just going to run through these. I wasn't proposing to go over them in any great depth at this stage. This really is an overview. Depression, social isolation. This is moving from a situation of, particularly if you've been in work and then out of work, it really is a major disruption to our social environment. Even if we don't socialise, sorry, yes?
I presume you mean paid work?
Yes, paid work, or in fact it was an interesting debate that whether it has to be paid work. The evidence tends to suggest that unless you are financially independent and the work that you do gives you gratification, that volunteer work where your income is at a pretty low level can still produce some of these effects as well.
I think that that's really important to
I agree.
out.
Yes, no, I agree.
One of the most common transitions from paid employment to unpaid employment is the birth of a child. Yes. Which is not, you may choose to call it voluntary, but I think that that's not quite what most people mean when they talk about volunteering.
That's right. I wouldn't regard that as volunteering.
But it's not paid work, but it is substantive.
It's substantive work, but some of the negative effects have been shown to impact in this situation as well, as was alluded to this morning.
Yeah, but that's what I'm interested in ensuring that we are clear about teasing out. Is it to do with the income? Is it to do with the social value of the work? Or is it to do with other factors? And so far you're muddling.
Yes, I am muddling at this stage because I'm making some fairly significant generalisations at an overview stage. To tease down to all the different levels and control for those, which many of the studies have done, by the way, you can actually show an independent factor. But I take your point, by the way.
And for the purpose of these 2 days, that's crucially important.
Yes. Yeah. I accept that.